There's a few people that have asked about if you have dry eye, are you a candidate for laser vision correction? The answer is usually yes. Most people who have dry eye can be treated really successfully and rapidly with the latest medications we have today. And if they have not been used, then you've been left with untreated dry eye. And a lot of those patients are not actual dry eye patients. A lot of patients who think their eyes are dry actually have allergies. And probably about 90% of the patients that come in here saying they have their eyes feel dry or they have dry eye actually have allergies. And allergies have gotten much worse as the climate has changed, as we've had more CO2 in the atmosphere and increased heat, because that increases the amount of pollens released by trees and plants by magnitudes, not just percentages, by multiples. And it is also affected, as we've seen in studies coming out, by pollution. And so as an area gets more congested, the particulate matter from the pollution will also increase the allergic inflammatory response in people's eyes. So you take all that, put that together, as you know, a lot of our urban areas are getting a little bit more polluted, a lot more pollens, and getting a lot more irritated eyes. And a lot of those patients actually say their eyes feel dry because as soon as patients get allergic inflammation, the allergic inflammation actually breaks down the tear film, prevents it from being spread around properly, and they feel their eyes are dry. It all depends. The short answer is most patients who are told that they have dry eyes and can't have LASIK are told that incorrectly. Because you absolutely can, because there's wonderful treatments for it. A lot of patients don't even actually have dry eye. Their tear film's pretty good, but their symptomatology and problems come from allergies, which are made worse by wearing contacts. The contacts are like big sponges that grab allergens and pollution and leave them in your eye to keep irritating them. Okay? So a lot of these patients actually, once you do their LASIK, don't have dry eye. Okay, because they don't have the allergens and they don't get the same allergic response the same way. And as time goes on, they might have it at the beginning a little bit because we made them more sensitive. But as time goes on, their dry eye actually, quote unquote, dry gets less because it wasn't dry in the first place. So the majority of patients can have LASIK that have been told they have dry eye. And if you do have dry eye, the treatments for them today are so very, very, very good, rapid. We have treatments that can literally change the amount of tears your eyes make in minutes. It's a completely different game than even 3 or 4 years ago. And so it's actually really straightforward and a lot easier to treat dry eye today. A lot of times the problem is a lot of the new treatments aren't well known, but we certainly use them and it's usually not a big deal. So less and less is becoming an issue. Dry eyes is becoming less and less of an issue. And on top of that, there are procedures that can be done that cause less dry eye, also from laser vision correction. So a lot going on here in this topic, and a lot of it is positive.